I'm Devin Pierce. I'm a recovering addict. I've been doing heroin since I was 16 years old, and it has destroyed my life. It has destroyed my family's life. It's destroyed the members of my church. It has destroyed their life. They have all been there to support me and love me, and that is one huge thing as an addict that you need. So do not give up on your family members. Please don't give up on them. They are not the same people when that drug is inside them as they are without that drug. We are loving, we do care, and we appreciate everything that you guys do. And as Sheriff Ron Spike said, it's in one of these little notes here. He said we hit him in high school. We hit him at 5th grade with the DARE committee. We don't hit him again in middle school. We don't hit him in high school. And I feel that's what we need to do. We need to push for this. What has been done now, it can be stopped, it can be prevented, but we can prevent the younger kids from going in the same steps that I took, and I don't want to see anybody fall down the same path that I went through. And whatever I can do to help from family members that have addicts in their family, please ask. I will be there to help. We have a Narnon group in this community, and I sit in that group and I hear the struggle, just like I hear the struggle coming from these women about their family and their losses, and I'm sorry for that this drug has taken your children. That has to hurt. I know it hurts. That's horrible. That could have been me. And the Narnon group is just a great group. The families get together, they talk about it, they try to help themselves. They need to figure something out for themselves. And as addicts, we have nothing around here. We don't have NA groups. I've heard of one NA group since I've been home. Have I been able to participate in it? No, because I don't know where it is. Do we have a rehab in this community? No, we do not have a rehab in the community. It's something that we need. Right before I went to jail last time, September 2nd, I got arrested. I was going to turn myself into a rehab, but on my way to a rehab, I can get drugs. Why not get high before I get to the rehab? You know, we need that where we can go in right in this community and go in and say, hey, I need help. You know, that's what we need here as a community. I know this community can come together. We've done it. Look what we did for the flood. Look what we do for the school students, Penny and Mustangs. This is the home of Penny and Mustangs. We can do this, guys, and we all ask for your help as addicts. I'm not speaking for all of them, but I'm speaking for myself. I need your help so I can help other people, please. And that is what I want to do, is help the people that are in need. And I thank everybody for coming out here, guys. I really do. This means a lot, just so you can hear my voice as an addict. This is awesome. Thank you. We also have groups that are participated in the jail ministry, the Inside and Out program, and that's for a transaction that when you're in jail, these guys come in and talk to you, they help you, they support you, they love you. They're not giving you money so you can get food or anything like that, but they're giving you love. They're caring for you, and that's what their biggest thing is love. It is a Christian-based thing, but that's not who they come off as. They just come off as people. They come off as people who care, and it is a great program. The Narnon program, as I said, is for those families. They're hurt. They need help. They really need help. The AA meetings we got going on around here, that's awesome. But do we have anything for narcotics? We do not have anything for the opiates. We don't have anything for that. Yes, we have FLACRA. You got $30,000 a year to put yourself in FLACRA? Because I know I don't. We need help. We need to be able to walk to a program and get the help that we need, guys. And I ask for the help. Please, as an addict myself, I need the help. Please. Thank you so much, guys.
Thank you. Thank you so much, Devin, for being here and sharing that with us. I missed, or maybe to say, how old are you?
I'm 23 now.
23?
Yes.
Okay, and how long has it been since?
Since my last use?
Yes.
September 2nd was my last use.
Well, thank you, and good luck to you.
Thank you.
Next, we have Gail Owen. Gail, thank you for being with us.
Yes. Thank you very much for allowing me to bend your ear for a moment here. First of all, those of you who know me, and I do see some familiar faces out here. This is way out of my comfort zone to speak to people like this. So if I'm able to step out of my comfort zone for 5 minutes to help another family to not go through the baloney that I've been through, I've done my job. Not many people have heard this story that I'm about to tell, and my mother is sitting in the front row, and she has not heard this story, and no grandmother should have to hear this about her grandson. So I apologize in advance, Mom. The story I'm about to tell, I went to my son and told him what I was going to say. I got my son's permission to tell this story. And I told him what I was going to say, and he said, Mom, I don't remember any of that story that you have my permission, but I don't remember any of that happening. So, now, speaking as a mother who's been through more than I have ever wanted to go through, here are some of my thoughts. A little over 2 years ago, in November of 2013, my son came to me asking me for help as he was going through heroin withdrawals and he didn't know what to do, and neither did I. I first called my doctor as to what I should do with him. She said to take him to the emergency room. The emergency room doctor gave him a drug to treat the symptoms of withdrawals, and I was told to take him to the Elmira Detox Center the next day. I remember crying to the emergency room doctor before he was released to me at 1 o'clock in the morning, saying, I don't want to take him home. I don't know what he will do when the withdrawal drugs wear off. I was scared to death. What kind of mother does not want to take her child home? The fact was, he wasn't my child. It was the drugs that had taken him, and I had no control over it, and I just wanted my son back. I took him to the Elmira Detox Center the next day. Once we got there, we had to wait until a doctor could see him. During that 5-hour wait, the drug that the emergency room doctor had given him the night before had worn off, and he was out of control. He was so out of control that a security guard had to come and watch him. He tore his gown off and wrapped it around his neck. He tried to take a plastic knife to his wrist. He was a raging lunatic. He was a madman. He was totally out of control. He felt so horrible that he wanted to end his life. I stood outside his room and watched this happen. I had so many emotions as a mother: fear, helplessness, anger, frustration. I wanted to make everything right, and I couldn't. He stayed there for 4 days. Once he started using, he was always chasing that first high. On a positive note, he has been clean since September 12th, 2014, which is the day he turned 24. Prior to my son using heroin, he was picked up for 5, and I said, yes, 5 UPM charges, which stands for unlawful possession of marijuana, within a year and a half. Those are only tickets, which is just a monetary fine. I feel that these should be more than tickets. The first one could be a ticket, but after the first ticket, it should be a tougher penalty. This was definitely a pattern of drug use in which there was no consequence other than hitting his wallet, and that didn't have any effect on him. Finding treatment for my son was a nightmare. There was no inpatient facilities in Penn. When you do finally find an inpatient facility with an open bed, sometimes the wait is over a week, and by then the addict has changed their mind about getting help. You have to fight with insurance companies to cover their stay. You need to strike when the iron is hot and get the addict into rehab immediately. Insurance wants you to fail at outpatient before they would consider paying for inpatient treatment. Inpatient treatment can be very expensive, costing thousands of dollars a month. My son's first rehab was 4 days in Elmira. The second rehab was 14 days in Tully Hill. The third rehab was 30 days at G&G Holistic in Florida, and when I put him on that plane in Syracuse, I didn't know whether I'd ever see my son again. There is Flacker in Penn, which is an outpatient, and is, in my opinion, is not working, as I just find more connections to get drugs. The employees at Flacker are good at their jobs, but we need more of them. Let's not forget the mental health part of this. People have mental health issues, and they try to treat that problem with drugs and alcohol because seeking help for the problem is sometimes a stigma that shows weakness. Both my sons learned about the Just Say No program in 5th grade. The Just Say No program stopped at 5th grade. I am not sure how the middle school handles the topic of drugs, but maybe the Just Say No program could follow through to the middle school and beyond. The drugs and smoking issues seem to start at a much younger age. Middle school students seem to have little fear, and peer pressure rears its ugly head. We need to start the education of dangers of drugs and alcohol at the elementary school in grades third and fourth grade, using appropriate language for them to understand. When children get to the middle school and academy, it may be too late. Some may have already experimented with drugs and alcohol. If a student is willing to put an unnatural or unhealthy substance in their body, it shows to me that there is a willingness to do more dangerous actions. This is not always the case, but it could happen, and it did happen with my oldest son started smoking pot in 7th grade. By the time my son got to the academy, he was smoking marijuana frequently, and I used to think that marijuana was the least of my worries. Boy, was I wrong. This is just a short synopsis of what I have done to help my son in his recovery. No parent should have to go through an ordeal like this. So in closing, I would like to see the following take place in Yates County: a program for the elementary students to learn about the dangers of drugs, stiffer penalties for unlawful possession of marijuana charges, a rehab center in Penn, more outpatient facilities for addicts to go to for counseling, insurance companies to recognize that this is a disease just like cancer and needs to be covered. Thank you for listening.
Gail, thank you very much. Thank you so much for sharing that with us. And I think with that bit of a segue, and thank you all of the individuals that are here to talk about your personal circumstances. Every circumstance has terrible consequences. They're all very different, but they all involve the same drug. I thank you for sharing how difficult it is to share that with all of us here in a room full of this many people. And with that, I think we'll move into our educators that are here and talk about what is going on as far as prevention in schools, what you'd like to see going on as far as prevention in your schools, and what it's going to take for you to be able to do that in your schools, because there's none of us sitting up here that want to put another unfunded mandate on our school districts. So our panel here is Superintendent Howard Dennis from Penn, Superintendent Kelly Hauk from Dundee, Superintendent Tommy Phillips from Watkins Glen. Howard, we'll start with you. Now, let me just point out, in the interest of time, I know you guys have, there's no need to read your whole, we have your testimony, and it's fine to read if you want to, but don't feel you have to read the whole thing, because we have it in the record and it's part of our package. So just hit the high notes, and I appreciate you being here.
Sure. I've been adjusting my speech throughout the evening, so hopefully it'll make sense. But thank you for the opportunity to speak tonight, because this is the premier challenge facing Yates County and Penn Yan. You know, as educators, every school district's mission includes educating and informing our students on a daily basis. And we teach health curriculum in Penn Yan at the mandated levels according to the State Education Department. But in the past, we were able to offer more. And I've heard tonight the reference to many different times to additional health education. I would agree with that. Unfortunately, the reality comes about that over time, due to budget cuts, due to restructuring, we've had to cut back on additional programming that we've had. So any assistance that the state government, the state legislature could offer as far as funding goes, that would be beneficial to our students. And I agree with you, Senator, the financial support without the unfunded, without the mandate would be wonderful. The second thing that would be really helpful to us as a school district in Yates County and in Penn Yan is after-school programming. We want to have those positive role models. We want to have supportive and creative places for our students to go after school so that we can offer possibilities for them, and that's become a board goal for us here in Penn Yan, is to push for more and more of those possibilities for our students. We want to be able to offer them education in those smaller settings, positive role modeling, and unfortunately, we're not able to offer those at this time due to the financial support that would be needed to establish and to continue those. I believe that Penn Yan community is very supportive and generous in the support that we can offer to our students. We're able to offer dedicated psychologists, social workers, youth counselors, guidance counselors, and other support professionals, but obviously it's not enough. You're hearing from some Penn Yan students tonight who've gone through the program, and so we need more of those. Right now, those are falling totally on the local taxpayers, and we need additional support in order to offer the services, because as you've heard, those services aren't offered in our community, and so the school district wants to help step up and do as many of those things as we can. But again, the resources are tough. Once addicted, the individual then has to go on and look for counseling, and you've heard that many times this evening. And the scarcity of those treatment facilities here in rural areas is difficult. You know, I heard a story recently about a community member on our staff who had convinced their family member that they needed help, and went and finally worked through that entire process and reached out to their insurance carrier, and I think you've heard this referred to tonight. The response from the insurance carrier was unbelievable. They didn't qualify for inpatient treatment because they hadn't failed enough times at outpatient treatment. And as we talk about the heroin epidemic and the outcome of that, that's an unbelievable statement for anyone to make, is that you have to fail enough times with that drug in order to qualify for higher level services. You know, if you compare that scenario to the whole idea of being educated about anything, the treatment model that we have at this point is not adequate. You know, learning in general doesn't happen in 3 or 4 days with no follow-up, and so anything that we can do in our community to help with that kind of follow-up and support for people in our community would be helpful. We're very fortunate in Penn to have a school resource officer. Our SRO is a village policeman, but again, we have one person who's trying to maintain a level of education around drugs, trying to maintain relationships with kids in a 1,500 student school district in 3 different buildings. That's a very tough situation for anyone to be in, and he does an excellent job for us, and we're very lucky to have him again. But we could probably use 3 of him, and that would be tough for our community to step up and be able to support. Our county legislature as well has talked about additional drug enforcement staff, and again, the funding is a tough piece of that, and the district would be willing to help step up and help support that in any way, but we do not have the funds to do that. Legislating stronger and harsher penalties for dealers is overwhelmingly encouraged, and many of the ideas that I received tonight, I actually went out and garnered from our staff. You know, I looked for support, including from some people on this panel that stepped up and said, Howard, this is what needs to happen. This is what you need to advocate for. You have this opportunity. Make sure you send this information along. So I am touching on some things that have been duplicated, but it's because they were important to our staff. So, you know, in conclusion, I've cut quite a bit out of my speech, but in conclusion, as what others have said, we need your help with funding. We need your help with legislative reform, and those are things that you've heard throughout the evening. So I'm grateful for the opportunity to reiterate some of those, and thank you for the opportunity to speak.
Thank you very much. Kelly.
Thank you. Since Howard so graciously cut some of his, I'm going to keep all of mine. Thank you, Howard. So, and also before I begin, I want to thank you again for this opportunity, but I feel like I would be remiss right now if I didn't thank the panel that went before me. You truly touched every one of us, and I know how difficult that was to share those stories. My heart aches for each and every one of you. Thank you for being so courageous and being here with us this evening. I appreciate that. So my testimony is really a story of sorts. So I'm going to share a story from the Dundee Central School community, and with that I have some suggestions for help and assistance and some need that we desperately have in our school but also in our community. Heroin and other drug use has become an epidemic in our community and in our county. Just like any other epidemic, we must work together to eradicate it. This is something we cannot do alone. However, we can accomplish together one. Everyone is part of the solution, and we cannot allow this growing and pervasive problem to touch or take one more life. In my school district of just over 700 students, heroin has taken the life of a 17-year-old girl, a high school senior with her entire life ahead of her, and a former Dundee Central School student, just a mere 23 years old, again an individual with a whole life ahead of him. This has happened in just a mere 3 months. And I cannot reiterate enough that fortunately I had the opportunity to get to know the 17-year-old student in my year and a half at Dundee, and she was not that kid. I cannot say that enough to you. She was not that kid. And even though I didn't get to know the 23-year-old that passed, from all the stories of his high school athleticism, he was not that kid either. This does not discriminate. It touches everyone and anyone. Additionally, it has touched the lives of many faculty members and students by not only their relationship with these two individuals, however, through their own family members who are currently struggling with addiction or even worse, still actively using despite their pleas and exhausting efforts to quit. It leaves me to ask the question, how many more people must die or who must die in order for this to finally be enough? I can't begin to explain or paint a picture that is vivid for each of you that accurately displays how heart-wrenching it is for me to send an email to my entire faculty that I need to have an emergency faculty meeting with them before classes begin, to where I can share with them that we have lost another child, or how incredibly devastating it is to a student's classmates when faced with the harsh reality of the tragic loss of an untimely death of a fellow classmate. Watching these students gather in the school foyer, carrying purple helium balloons with memories and messages of love and I'll never forget yous, as they walk as an inconsolable group to the funeral home to say their goodbyes to their classmate, their childhood friend, their fellow cheerleader, the person who they sat next to in English class since 7th grade. As I try to comfort them and help them through one of the most difficult times in their lives that they will ever experience, I find myself not being able to control my own thoughts and fears that this will not be the last time that we walk this walk. The cruel, harsh reality, it will only be a matter of time unless significant, actionable, and tangible steps are taken to combat this epidemic. According to the American Society of Addiction and Medicine, drug overdose is the leading cause of accidental death in the United States. Opiate and heroin addiction is driving this epidemic. 4 in 5 new heroin users started out misusing prescription painkillers. As a consequence, the rate of heroin overdose deaths nearly quadrupled from 2000 to 2013. In just 3 years, from 2010 to 2013, there was a 37% increase in heroin overdose deaths. The current largest group of heroin users are between the ages of 18 and 25. This group is also the cohort that continues to grow exponentially over all other age group and users. Adolescents, my students, your children, are falling victim to this addiction faster than we can intervene. Research has indicated that over 30,000 adolescents have used heroin in the past year, and more than 50% have moved past into the world of addiction. These are national statistics, and yes, they matter. However, honestly, these statistics that matter to me most are the ones that are occurring in our own county and in our own schools. I firmly believe that the solution to this problem is multifaceted and involves many layers, with education being the center and the pillar that every layer is anchored to. We must be proactive in our approach to addressing heroin and opiate addiction epidemic. We now, more than ever, have the chance to fight this epidemic, but we cannot wait. We must combat this before it even begins. Effective, meaningful, and result-driven educational practices surrounding this issue requires resources. It's not just an option, it is a necessity. Resources such as financial assistance and people, such as full-time public health educators in our schools to coordinate these efforts is critical. We need the monetary support to procure people who are well-versed in this work, identifying the risk factors, creating intervention plans, and assisting preventing the addiction before it becomes a reality. With this comes the need for financial assistance with programs and outreach opportunities, as well as certain real-life experiences for our students to participate in that clearly and vividly illustrate the dangers of involving themselves in this activity. Lectures and pamphlets and videos are not enough. We need to provide and create meaningful engagement for our students and their families, and these need to be ongoing. This education cannot be a one-and-done platform or a 6-week course. Our education strategy and implementation needs need to be pervasive as the heroin is in our community. This education needs to reach beyond the walls of our schools and needs to act as seepage, seeping into our community and into our toughest neighborhoods. This work cannot be accomplished without proper financial resources and people needed to carry this work forward. We cannot continue trying to solve the problem by being active and expecting different results. Our own local history clearly illustrates that the current methods are insufficient. Ultimately, even with the best education practice in place, we will not stop all heroin and opiate addiction. Therefore, another layer to the solution that I referenced in the beginning of this testimony involves treatment plans and facilities, which at this point in the great state of New York are dismal at best, a clear picture of inadequate. When the hardest decision of an addict's life has been made to seek help and assistance to begin the very difficult and challenging path of recovery, it is completely unacceptable that there is not a treatment facility or an option immediately available to them. When told that it will take 2 or 3 months or even longer to start the process, that we have in sense told the addict to keep using. These individuals are barely holding on minute to minute and can't fathom how they will make it through another day, let alone a month or longer without using. And that is exactly what we are forcing them to do by not having adequate treatment facilities and recovery essentials available and accessible. School districts are having the hard and difficult conversations with our students and faculty. We impose accountability to the greatest extent our authority allows us to do so. However, we need all stakeholders to be part of this work. Parents, families, friends, community members, and our elected officials all must be part of the solution. We need to invest in what matters. We need to invest in our future. We need to invest in our students' emotional, social, and mental health in order to eradicate this epidemic. The treatment options and resources for addicts need to go beyond just addiction. We need to promote support and provide better and stronger mental health services for our students and communities. In attempting to make an appointment for a student in crisis to have a complete psychiatric evaluation, due to the clear and evident lack of resources and availability of mental health services, it took 2 months for a student of mine to be even given an appointment. It is very transparent that there are significant mental health issues and needs that are severely underdiagnosed and therefore not treating, which is leading to an increased drug use and activity. We absolutely do not have any local control over the lack of mental health services in our schools and in our communities. A significant amount of preventative measures could take place if the services were available. Additionally, support is needed by providing adequate funding and resources to our local law enforcement. This must entail the addition of a drug investigator. It is evident that our county law enforcement does not have the resource or capacity to address the heroin and opiate epidemic that is eradicating and taking hold of our communities. To expect that any changes will result in using the current structure and system is nothing more than a fallacy. As an educator for several years and as an educator who has worked in several capacities, I have never witnessed the devastating effects that heroin has had on a school and a school community as I have over the past few years. I shudder in fear at the thought of losing one more child. I ask all of us to stop and think, if that child was your son, daughter, granddaughter, grandson, niece, or nephew, what would you expect these changes and what would be warranted to stop this epidemic? This epidemic does not discriminate. Everyone is vulnerable to it. All of these children are mine, and I take that to heart. And I am at the place of the cold, hard truth that I do not have. I can't provide the resources needed to save them alone. Our system and resources are at capacity. My children, my students, our collective future is dependent on significant changes being made regarding allocations of resources and funding to truly eradicate this epidemic. Thank you.
Thank you, Kelly, and for the work that you've been doing. You've been certainly at the front lines in recent months on this, and I do thank you for being here and participating in this forum this evening. Mr. Phillips.
Thank you, Senator O'Meara, Assemblyman Palmisano, and members of the Joint Senate Task Force on Heroin and Opiate Addiction for hosting the public hearing and soliciting input relating to stemming this crisis. I'd like to start by recounting my attendance at the New York State Physical Education, Health, Recreation, and Dance Conference this past November. I attended several workshops. However, I never believed in my most vivid imagination that I would leave that conference as a trained responder in opiate overdose prevention, including the use of intranasal Narcan. While I applaud the association for taking the initiative to train attendees, the reality that as an educator I would need this training was sobering. This clearly speaks to the scope of the epidemic we are facing. As to the specific questions, my answers to both of these questions focus on the need for a community approach to addressing this epidemic. Remember this, rural schools in upstate New York often do not have a YMCA, a YWCA, or a Boys and Girls Club. We don't know what they are. As I've learned through the process of developing community-based school programming, there's not one agency or institution in any community that can address this epidemic alone. This will require collaboration, sharing of information and ideas, as well as shared responsibility for quality implementation of community programming. First, one cannot focus only on the results of heroin and opiate abuse. The real question is, how do we prevent this from happening? My experience tells me we need to create a sense of community and develop what I refer to as a surround and support climate that is inclusive. The community school approach or a similar model provides support for academic assistance and enrichment, wellness activity, addresses child care issues, family support centers, summer programming, as well as quality before and after school activities for our children. Additionally, let me say, some of the best money ever spent by the state of New York was the School Resource Officer Program. We must break down the silos of mental health, children and family services, our court system, healthcare systems, and any other governmental agency or community service provider, in addition to the regulations that prohibit information sharing. I understand the right to privacy, FERPA, HIPAA, for individuals, but when the right prohibits or delays meaningful collaborative intervention for individuals or family, the consequences can be disastrous. Funding. This does not necessarily mean additional monies. The reality is the state and federal government spend an enormous amount of money and resources on the establishment of bureaucracies, departments, and institutions, all focused on providing assistance to family and persons in need. There is enormous duplication of services within our communities. This is a direct outcome of the barriers in place that prevent meaningful collaboration between school, community agencies, and the courts. I believe all communities would benefit from an effort to coordinate service, including resources, as a means of streamlining intervention and providing education and assistance to those in need. Additional funding. The concept of grant funding or competitive funding for communities simply does not work. If the state believes the academic is a priority, then fund it. On a personal note, at Watkins Glen, we are already discussing what options we have for our community-based school program once the grant funds expire. This is not an effective strategy for quality program development. In closing, I would like to again thank Senator O'Meara and members of the task force for their commitment to addressing the heroin and opiate addiction epidemic. I believe there are two primary issues that need to be addressed: the establishment of community schools or a similar model in an effort to create a surround and support climate that includes educational support and enrichment, wellness programs, family support centers, and the like. When children and families feel a sense of belonging, they are more likely to be productive and willing to seek intervention when needed. Finally, appropriate levels of funding for such community centers, whether through a more coordinated effort of existing resources or the elimination of competitive and non-competitive grant funding. If we are serious about addressing this issue, we need to provide the funding, inclusive of sustainability options for programs once they are established. Again, thank you for asking us for our input.
Thank you, Tommy, for that. Now we're going to stretch our neck back over to the left here for us up here. So we'll go back to panel 3, which consists of Danielle Tilden from the Finger Lakes Addictions Counseling Referral Agency, Anne-Marie Flanagan of the 8th Substance Abuse Coalition, Mike Ballard, the Council on Alcoholism and Addictions of the Finger Lakes. Danielle, would you like to start?